want to thank everybody who is on the phone, and I certainly want to thank our guests, who I'll introduce in just a little while. We meet at a very troubled time in our country's history. I don't think any of us on this phone call, or frankly in this country, or perhaps worldwide, has experienced the kind of challenge that we're experiencing, both from a health standpoint and from our economy being essentially very substantially slowed down and in some cases shut down. So let me begin by thanking all of the first responders and the healthcare personnel who are on the front lines of this fight every day. What they do is incredible. I want to thank the nurses and doctors, police and fire, those people who are working in the grocery stores, whatever they do in the grocery stores, truck drivers who are bringing us goods that are absolutely essential for our life on a daily basis, to all the people, I mentioned the nurses and doctors, but all the people who work in all of our hospitals and healthcare providers. I want to thank the teachers. I know my granddaughter, who has 4 children and lives in Calvert County, it raves about the teachers of her children, and her children are in 4 different schools. And she is saying that the teachers are doing heroic work to make sure that our children are educated. But the heroic work by those of you who come in contact with health challenges on a daily basis, we owe you a particular thanks. So let us keep thinking of them. Let us keep thanking them. And when this is over, let's make sure we thank them again. Let me also say that the coronavirus continues, as all of us know, to pose a significant threat. And we continue to meet this challenge together. And I want to thank everybody who's playing by the rules, wearing face masks when they go to stores, staying home. That's the way the experts tell us we're going to defeat this scourge. We are resolved to defeat it and save lives and bring our economy back to a strong life. Maryland remains under a strict stay-at-home order, as you know, to protect the most vulnerable in our communities and to prevent our healthcare system from being overwhelmed, which it's close to at this point in time. This will continue until public health experts tell us that it's safe. If we don't do that, if we get back too early, the virus will regenerate itself and be worse. I know that many in our communities are worried because they are, or their loved ones have lost their jobs or had to close their businesses, and it's unclear how long that will last. Let me assure each and every one of you on the phone that no matter how long this crisis lasts, and I hope it's over sooner rather than later, that your congressional delegation, Republicans, Democrats, are working together with our governor, who, by the way, we think has done a very good job in confronting this virus, and with state and other local officials who are also working round the clock to make us safer. The small business loans that we secured will help a number of people, including those of you who are self-employed. That's a very important point because you weren't eligible for small business assistance or unemployment. While their doors remain closed and can be ready to resume normal operations, these small businesses are being supported. And I know that it's frustrating because it was so much to do for our small businesses. We have 4 people from the state level and the federal level who are going to give you some information about what's the status so that you can get the kind of help you need. The loss of life, of course, that we're seeing from this virus is heartbreaking. And if there are any of you who have lost somebody to this virus, my heart goes out to you, and I give you my greatest sympathy. We're trying to make sure, however, that the loss of life is kept to as low a number as we possibly can. But we're seeing signs of hope, where strict social and physical distancing measures, like the ones we put in place here, have been imposed. The rate of growth of new infections has slowed. It's still growing, but the curve has been flattened out, which is what, of course, was our objective. It's critical that we all continue to do our part by obeying the governor's order and staying at home, except for going out to purchase or pick up food. And by the way, don't forget to wear your face mask. That's very important for the workers in the store, safety, and for yours. Go to the pharmacy, travel to an approved essential job, or seek medical care. Wear those masks, wash your hands, stay 6 feet apart. I've been in close communication with Speaker Pelosi, Leader Schumer, Mr. McCarthy, the Republican leader, and Mr. McConnell, the Republican leader in the Senate. And, as I said, on a regular basis with Governor Hogan and our county executives and county commissioners as Congress works its next package of legislation to address the coronavirus. It is clear that we must approach the public health challenge and the economic challenge together, because we cannot reopen our economy until we have the public health infrastructure in place to keep outbreaks under control and protect those most at risk. We need to test. We need to test more, and we need to test even more. And the reason for that is the more we test, if we just test the sick, we won't know how many people are infected. But if we test a large number of people, which is what South Korea did, we will identify, be able to isolate, and then to trace those that they've had in contact. And that will help us greatly. The first bill that we passed provided $8.3 billion to support research into a vaccine and into treatments. The second guaranteed that Americans will not have to pay out of pocket for COVID-19 testing. There is no cost for testing, and provided paid leave for those who are sick or in quarantine. The third law, which we just recently passed, the CARES Act on March 27, focused on helping workers and businesses get through the crisis. It was a bill that authorized and appropriated over $2.2 trillion, an extraordinary sum of money, but our economy is huge, and we now know about 20% of it is shut down. That money may well not be necessary. Enough. Well, may not be enough, and we may have to do more, and we are working on doing so. Now, that bill included the following. Some of you may have already gotten a payment, but $1,200 per adult for those earning $75,000 or less, and a couple earning less than $150,000, $2,400, and $500 for each child. In addition to that, there's $600 for a period of time, a number of months, in addition to the unemployment insurance that is available in Maryland. And as I said, the self-employed, the people who are working in the gig economy, people who were not traditionally included in unemployment insurance are now included under this bill. And the federal government will be paying $600 per week extra for the next few months to supplement the unemployment insurance. There's $100 billion for hospitals, and frankly, we're going to need more. $17 billion for veterans care, critically important. We want to make sure our veterans are safe. And funding to ensure that the coronavirus pandemic does not disrupt elections in November. I'm deeply concerned, as I know so many of you are, by the racial disparities we are seeing in this pandemic. African Americans and Hispanics and other minorities are dying from coronavirus in a proportion way above their proportion in our population. We need to be very concerned about that today and in the future. We need to collect data to fully understand the impact on African Americans and Latino communities, which are being hit hardest by this virus. And we need to make sure that states and communities have the tools they need to keep everyone healthy and safe, regardless of their race or background. A virus does not discriminate. Sadly, though, longest-standing inequalities and inherent bias in our healthcare system have been laid bare by this pandemic. It is a wake-up call for us to do much, much better in the future. This is unacceptable, and we have responsibility to address those disparities. I'm also working hard to make sure that our elections are secure and that every American can vote safely, either by mail or in person in November. Governor, we have a special election in the 7th Congressional District of Maryland, resulting from the death of Elijah Cummings, such a beloved figure in our state. That election is going to be held primarily, almost exclusively, by mail. I've urged the governor to make sure that the June 2nd election can also have the ability of every voter to vote by mail if they so choose. We also need to protect the Postal Service. I don't know about you, but I'm at my house, and obviously I'm on the phone a lot, working with other members to try to make sure that we're doing the right things to protect America and to make us well and to make our economy more vibrant. The fact is, though, that I look forward to the U.S. Postal Service delivering my mail. Now, like you, they deliver probably too many bills, but I get communications, and I look forward to that. Postal Service is a critical connector of all of us to others, and we must make sure it does not go bankrupt as its business decreases. We must also make it clear that the District of Columbia should be treated like the states when it comes to receiving its fair share. It is usually. It wasn't in this last bill, and it cost them $700 million. I'm going to work very hard to make sure that we treat them as a state, and they get the $1.2 billion that every state got, even states much smaller than the District of Columbia. If they're not healthy, we're not going to be healthy. And if we're not healthy, they're not going to be healthy. We're in this together. Shortchanging the district was a mistake, and we're going to try to fix it. I will continue working with Delegate Holmes Norton and the regional delegation toward that end. I've also made clear that we need to do more to keep federal workers safe by investing in technology modernization that facilitates telework and by extending full paid family leave benefits to all federal employees, as we did for others in previous legislation. I will continue to keep the 5th District residents informed in these town halls and in many other ways of new developments. And I want to hear from you about the challenges you're facing and how we can help. Now, hopefully all of you got a pencil, a pen, or a quick finger on your typing apparatus. To get in touch with me and get the latest information on what Congress is doing, I encourage everyone to visit my website, Hoyer, HOYER.house.gov. You can connect there. You can give me messages there, and we can keep in touch. We want to know your problems, and we want to know what we can do to help you and your family. Now, as I said, I'm pleased that we are joined tonight by guests who can answer questions about how we are fighting the coronavirus and how recent legislation can help people in Maryland's 5th District and indeed in our state and throughout the country get by until our economy comes fully back. First, we have Dr. Josh Sharfstein. Dr. Sharfstein is at Johns Hopkins Bloomberg School of Public Health, an Office of Health Practice and Training. He's also a former Deputy Commissioner of Health in Baltimore City, and he was at the U.S. Food and Drug Administration and also worked for a member of Congress. A real expert, and we're glad to have him. Welcome. We also have Michael Harrison, who's Policy Director at the Maryland Department of Labor, Licensing, and Regulation. He'll be able to answer a lot of questions about how you qualify, how you apply, and when you're going to get resources. Andrew Fulginiti is also with us. He's a policy officer at the Maryland Department of Labor, Licensing, and Regulation. That department handles a lot of the flow of money that we are trying to get to people in need and businesses in need. Also with us is Antonio Doss. He is the District Director for the Small Business Administration's Washington Metropolitan Area District Office. He, too, can answer your questions about how you get your small business loan, grant, assistance. And lastly, but certainly not least, Stephen Umberger, who is the district director of the Small Business Administration's Baltimore district, serving all of Maryland except for Montgomery and Prince George's counties. Gentlemen, I want to thank you very much for being with us. And with that, let's go to questions.
Thank you, Congressman Hoyer. Again, if you'd like to ask Congressman Hoyer or our expert a question, please press *3 now. Again, if you'd like to ask a question, please press *3 now. Our first question is from Rodney in Greenbelt. Rodney, you're live with Congressman Hoyer.
Hello. Thanks for doing this. I appreciate it. I just had a question. I just had a question about the stimulus checks. My mom is on Medicaid. She lives in a nursing home, and so her income is limited to $2,500. And I'm concerned that when she does get this check, if she gets it, that it's going to take her income over the limit and threaten her Medicaid eligibility. And I was wondering if there's been any conversation or information about that. That's it. Thanks.
That's an excellent question to which I do not know the answer. I will find that out if one of our guests does not have the answer on the tax question. But no, I was just given the answer. The rebate will not impact for Medicaid or other public assistance programs. In other words, that will not put her over the income level. And the reason for that is our intention is not to hurt people, obviously. Our intention is to get money in people's hands so they'll go out and spend it. And 70% of our economy is a consumer economy. So it would be unwise of us to penalize. This is your mother or your aunt? Mother. Your mother. It would be unwise to try to penalize her and put her in a different category so that she was ineligible for other benefits she obviously needs. Because what we'd be doing is helping on the one hand and undermining the economy on the other. Hers personally, but the economy generally. So the answer is no, it will not be counted against her.
Great. Our next question is from Adrian in Clinton. Adrian, you're live with Congressman Hoyer.
Adrian, you with us?
Yes, I'm here. You can't hear me?
Okay. Now I can hear you, yes.
Okay. So my question is, the DMV is a tourist area like New York City, LA, and when the president opens parts of the country that is less impacted, what happens when our numbers start to stabilize and go down, and those people who are having trouble recognizing that there is a pandemic, what protects us from them or becoming reinfected? What protections will be put in place to protect the areas already, battling the pandemic and has hit the plateau and is now coming down? What happens to us?
Now, here in this Washington metropolitan area, you mean, to
Yes.
us?
Yes, I was just pointing out that, we are a tourist area.
Yes. You raise a very good question and a significant concern. Now, I'm going to let Dr. Sharfstein speak to that, but clearly areas like Las Vegas have been devastated because they are tourist areas. Now, we have significant tourism, but that is not our only asset in the Washington metropolitan area. Obviously, we have the federal government here, which is a great stabilizing force for our economy, which we're very fortunate to have. But Dr. Sharfstein, I know one of the concerns is we come back to interface with one another too soon and reignite the transmission of the coronavirus, which is why Dr. Fauci and Dr. Birx and others are concerned that we do not come back so fast, that we undermine rather than help either the economy or our health. You want to make a comment?
Sure, thank you, and it's a great question. I do think that if there are places where they don't take this seriously enough, you're absolutely right. We can expect to see more cases there. And you're absolutely right. That will pose a danger to the places that are nearby, or if people get in the car or come to D.C., it'll pose a potential threat to the D.C. area, which is in part why we won't be going back to normal, I think, in this area right away at all. It'll be still with a lot of extra precautions, and people will probably still be wearing masks. There'll be a lot of distancing still. You won't see concerts or jam-packed museums or anything like that for a while, I think. So there'll be some protections here, but I think we're going to hope that people will see, governors will see, mayors will see, that if they don't take this seriously, the real harm is going to be to their own people, and lives will be at risk. And hopefully they'll learn that they need to follow the best guidance in order to protect their population too, and we'll get some peer pressure to at least shut down really bad decisions.
I think the doctor is absolutely right on that, and I think you're going to find every public health official saying, look, let's go slowly, and let's not abandon the safety precautions we've been making, i.e., as Dr. Sharfstein just said, wear a mask. The Governor Hogan has said if you're going to a drugstore, if you're going to a grocery store, you're going into some other store, wear a mask for your own safety and for the safety of the people that are in the store, particularly those who are working in the store and seeing lots of people. Wash your hands. And I think it's smart to, still keep a distance. We tend to be a very animated group of people, we Americans. We like to shake one another's hands. We hug one another. We like to talk to one another. We get just a couple of feet from one another, talk to one another. But we're going to have to be more careful because we're not going to be out of the woods overnight. It's going to take a long period of time, and we're certainly in the middle of the woods in many respects in many areas of the country right now. So we have to be very careful. Next question.
Thank you. Again, if you'd like to ask Congressman Hoyer a question, please press *3 now. Again, if you have a question, please press *3. Our next question is from Laura in Bowie. Laura, you're on with Congressman Hoyer.
Hi, thank you so much for doing this. So I'm a licensed acupuncturist, and I'm considered essential, and yet I'm trying to see the least people as possible. I'm probably seeing from 30 clients a week to maybe 2 or 3. But I'm still concerned, but those people are trying to avoid going to the hospital, basically. I'm seeing the most serious people that are trying to avoid going to the hospital. So my first concern is their well-being and my well-being. Even though we're wearing masks and we're being responsible, the risks are still there. That's my first question. What do we do? Healthcare providers that are essential, and we're barely making any money, but we're continuing to be open, and I have not received any benefits from any government agency yet. I applied for several. But, I'm in a position that I'm not sure how to handle this situation because I need to make a living. I want to help the people that are trying to avoid going to the hospital, and yet I know that there is a risk in me working. And at the same time, I'm not getting any financial help yet. So I'm in a position where I'm not sure where to go from here. I don't want to turn away.
Well, let's see if we can give you a little advice. I'm going to ask, obviously, Dr. Sharfstein to give you the advice. He's a health worker himself. I don't want him to give you that advice. But, Laura, are you in business for yourself? Are you self-employed?
I'm self-employed, and when I apply, I'm not sure that I put the numbers right, and I'm not sure. I didn't exactly understand what they were asking.
All right. Well, we've got 4 people here who may be able to help you because you're self-employed. You are eligible for unemployment insurance. Now, I'm not, and you've gone from 30 people down to 2 people who are most critical. I'm not sure. I don't know the answer to that, but maybe one of our guests knows. But, Doctor, let's start with you, and then we'll one or more of the other 4 of you can take the other part of the question. Doctor?
Sorry about that. Purely as a question of infection control, if you're going to be seeing patients, you really should look up the guidance from the Centers for Disease Control for full protection, which would be, if it, for what you're doing, I would assume would be like a mask, face shield, gown, and gloves for contact precautions. And you can find that on the CDC website around healthcare worker protection. But I would definitely make sure that you're adhering to those recommendations. And if you do that, you will reduce your exposure. I would also certainly make sure to screen your patients for any hint of any symptoms and not see patients who are coughing, for example, or have fevers or have lost their sense of smell or anything that could be the coronavirus. That still doesn't reduce the risk to zero. Mm-hmm. Go ahead.
Doctor, would it be a good idea for she has these two patients which are she's treating and that don't want to go to the hospital. Would it be good to have her make sure they take their temperature before she sees them?
It's not a bad idea, I would say. Yeah. Yep, I would ask them.
I know that's what the president's doing. Before people see the president, everybody has to have their temperature taken. So,
right.
obviously, is one safety factor.
Yeah, it does not eliminate the risk because less than half the people have fevers. But you could do that. But I would definitely, it's really the protective equipment and all the screening that you possibly can do.
Laura, let me thank you. You heard me at the beginning thank those in the healthcare delivery service that are showing such extraordinary courage and love for their fellow men and women. So thank you very much for staying at it and helping people who obviously need help. Okay, next question.
Again, if you'd like to ask a question of Mr. Hoyer or any of our guests tonight, please press *3 now. Our next question is from Susan in Indian Head. Susan, you're on with Congressman Hoyer.
Thank you. My question is to do with the unemployment. I have tried to go online and apply, and I've tried it several times, and it says that I am ineligible to apply online. I have to do through the phone center. Well, going through the phone center is worse than trying online. Just one day, I did it 218 times, and it was busy. Just today, I did 248 times. Twice the phone rang, but then you'd have to go and put in these numbers to get to where you have to be, only for them to tell you all lines are busy, call back another time, and then they hang up on you. And I wrote to you, I wrote to Hogan, I've written to everybody, and they say the same thing, call back at this time, you'll get your money from when you first got laid off, but that's not going to help my bills, because my bills, I can't say, well, you'll get your money when I can get a phone call through. So there's got to be something done, because I've been trying since March 10th, and I've been calling every day. I can choose my phone.
Susan, you heard me talk a little bit about modernization of our technology in the federal government. But I will tell you, there's not a person on this phone that doesn't empathize with you, including, I'm sure, our guests, when you call to order something or get a question answered, and you have a bill you have a question about, and you get pushed. Well, push 1, push 2, and then push 3 or 4. It drives you crazy. And I've had somebody call me and tell me they had called 800 times. You're over 400 in your 2 calls. But let me turn to either Michael or Andrew, or both, to see how you can help this lady. Who wants to take it? Michael, Andrew?
Thank you, Congressman. This is Andrew Fulginiti, and thank you, Susan, for the question. Certainly, like the Congressman stated, we empathize with you. We understand this is unprecedented times. We are facing a unprecedented volume of individuals in the state who are in that economic reality where they're looking either facing unemployment or a reduction in their wages, and they're having to apply for these benefits. So we're doing everything we can at the Department of Labor to try and handle the sheer volume that we're receiving right now. I can tell you that we are working very hard on several new fixes to hopefully address some of the concerns that you raised. One of those being the increase in capacity at our call centers. As you stated, there are currently some individuals, based on their circumstances, that are required to file a claim via a call center. So we're increasing our staffing at call centers. We've doubled our call center staff since this pandemic. We are hiring another 100 individuals, getting them trained to take claims, and we're also transferring another 150 internal staff from the Department of Labor to be able to handle the increase in calls we're receiving in our call centers. I would also note that we are working with some outside vendors in the private sector to improve our online systems. I believe we're going to have some big announcements coming out tomorrow about some changes to our online applications that will hopefully expand options for individuals and address some of the concerns you raised. But again, we understand people are having a hard time. Susan, you're definitely not alone, and we are working, I can assure you, around the clock to handle the sheer volume of claims and people that are in need. And we will get to everyone, and we will ensure that you get the benefits that you are eligible for.
Now, that's the bad news is that they are overwhelmed, and we have unprecedented numbers. Never have we had these numbers, even during the Depression, of number of applications every week in the millions. We've been in the normal is between 180 and 220,000 or somewhere in that per week. We are now in the multi-millions, 6-7 million people. 20%, I think, of our workers are unemployed. So you can sympathize with them. But here's Susan. Susan. I think, and correct me if I'm wrong, anybody on the phone, any one of our guests, I believe, and it needs to be explained, when you first applied, if it's 3 weeks later or 4 weeks later that you get the benefit will be retroactive, I think, to the time you applied. But gentlemen, can you speak to that? Michael,
yes,
Andrew,
Congressman,
Antonio?
Yeah, I can speak to that. Benefits are retroactive from the date of separation, not from the date that you filed. We have waived all deadlines. I know a lot of people are getting in mail that they have to respond by a certain date or they're going to lose benefits. Well, we have waived those deadlines, so everyone will receive benefits back to their date of separation. And also, we've announced that starting tomorrow, all recipients of current benefits will start receiving the additional $600 bump up in their debit card payments starting tomorrow. The day that you normally receive your benefits, you will begin seeing that extra $600 in your payments starting tomorrow.
Now,
so
Susan,
I know that's going to be a lot of relief for a lot of people.
That's $600 per week. And in other words, when you lost your job, the date that you lost your job, you will get the Maryland uninsurance rate. I don't know what your salary was, and I don't know exactly what the figure will be. What's the average, Michael? What's the average in Maryland unemployment benefit?
Well, the maximum is $435 a week. We haven't calculated the average from virus-related claims, but it ranges.
But it would probably be in the 350, 60?
Correct.
No, a couple hundred? Well, in any event, Susan, so you, in addition to the benefit, we are, everybody who's getting an unemployment benefit for the next few months will be getting an extra $600 per week. That's to try to get people through this very troubled time, and very frankly, it'll give you some money to pay off those bills that you may have slipped because you're simply not getting an income. So I think that's, at least for the short term, going to try to keep people as even as we can possibly keep their head above water. That's our intent, and we're going to stay after that. All right. Next question.
The $600.
Go ahead.
I was going to say the $600 is retroactive until March 29th, so I believe that's about 3 weeks. And so if people have been filing their benefits, they will receive $1,800 in their unemployment check just from the federal benefit starting this week, starting tomorrow.
So, Susan, that's the good news. The bad news is I can so empathize. It makes me so angry when they put me from one number to another number to another number, and then they hang up. It just drives you crazy. Okay, next question.
Thank you, Congressman Hoyer. Again, if you have a question, please press *3 now. Our next question is from Jared in Waldorf. Jared, you're on with Congressman Hoyer.
Good evening, all, and thank you for taking my question. I just wanted to know if there will be any type of resources allocated for college students since internships have been canceled and on-campus jobs have been canceled, and we don't qualify for a lot of the aid packages that have gone out. So I just want to know if there will be any resources allocated for college students. Thank you.
Jared, the answer to that is yes. And Jared, are you going to school now, or were you in school?
I'm currently in school.
Well, let me tell you this. Okay. Bowie State University is getting $6.5 million. University of Maryland College Park is getting $21.4 million. University of Maryland Global Campus, $5.2 million. St. Mary's College, $3.1 million. College of Southern Maryland, $2.5 million. Prince George's Community College, which has a lot of students, $6.4 million. Number one. Number two, 50% of that must go to students. Now, I can't tell you the distribution or how much you would get or what the formula, but I can tell you that we provided significant money, and we're going to do more, significant money for higher education institutions who I know sent their young people home. They had to give them a rebate on the room and board if they were living on campus, as well as, again, I don't know the formula, so I don't want to say a figure, but 50% of that is for the students and 50% for the college, which obviously is losing money at this point in time. And many of them, of course, still are conducting classes, but they're conducting classes online so that there is still the education available. It's just not at the college. But the answer to your question is, yes, we put significant money in for higher education and for students. And by the way, for those of you who are listening, we put significant sums of money in for K through 12. And we made sure that the school meals that were available to young people who qualified for those school meals, and some schools give everybody a meal, so nobody's identified, but we made sure that that program continued as well and gave assistance to the schools to ensure that that happened. Okay, next question.
Again, if you'd like to ask a question, please press *3 now. Our next question is from Terry in Greenbelt. Terry, you're on with Congressman Hoyer.
Terry, are you there? Terry? Well, we're probably having, yep. Are you there, Perry?
I think we might have lost the call, so we'll go to our next caller. Our next caller is Charles, who has a question about drive-through testing in Calvert County. Charles, you're on with Congressman Hoyer.
Hello, Congressman Hoyer.
How are you, sir?
I'm good, thank you. Thank you for your leadership, and thank you for hosting this call. Yes, my question is about the drive-through testing. Is this something that we're likely to see, and when do you think we might see it, in Calvert County and some of the other areas? Thank you again.
We are seeing drive-through testing. We have drive-through testing. We're obviously trying to make sure that there isn't shortage in testing material, and we're not doing enough tests, that's for sure. But there is drive-through testing. Calvert County, I talked to Dean Teague yesterday, as a matter of fact, about how they were doing, because I was concerned about their personal protection equipment. And they're doing pretty well. They're not flush, but they're doing pretty well. I don't know, and we'll find out for you, Charles, about drive-through testing in Calvert County at their hospital or some other site. I don't know whether there is one there or not. But we've got your number. We'll get back to you and give you the answer to that. And by the way, if anybody knows, maybe you can send us a text to Hoyer.house.gov if we know the answer to that question. Matter of fact, we'll try to find the answer to that question before we end the call.
Thank you, Congressman Hoyer. Again, if you have a question, please press *3 now. Our next question is from Nakia in St. Mary's County. Nakia, you're on with Congressman Hoyer.
Thank you so much for taking my call and addressing my personal concerns, and thank you a lot also for having this teleconference and allowing us to address these things. So I did have actually 3 questions, but my first question was, is there any sort of an inkling of a projected date of maybe school reconvening for the students? Is there anything in regards to that?
There is obviously a lot of discussion about that. That decision has not been made. The governor would be the one that would be making that decision. And he'll be doing that in conjunction with Dr. Solomon, who's the superintendent of schools, and we'll be discussing it with health care and providers. I want Dr. Sharfstein to speak to that, but I recognize him. Let me say that the good news is children under 17 are doing pretty well. They're not totally immune. There are children who are getting sick, but it seems to affect them less harshly. But, and this is the big but, they can be and are carriers. And so when they come in touch with, their mom or their dad or their grandmother or grandfather or others, they can transmit the disease. So that is a concern when you aggregate all these children together in school. But I'm going to turn to Dr. Sharfstein. Doctor, you got a thought on that?
Well, we're going to have to take it one step at a time, and I think in the document the White House is putting out tonight, they don't see the schools opening in the first phase, and I think that's probably right. The first phase is going to be gradual, and we're going to see whether, we can do that without the number of cases really jumping up. And that'll take at least, I think, a couple months to work itself out, to know for sure, at least a couple months from now. And then if we are able to do okay, we're able to open to that first level, a few more businesses open, and everybody practicing social distancing and wearing masks, and, that goes okay. Then the next level up looks like they may allow schools to open. But that's only if you do okay in that first level. And even then, when schools open, it might look different. It might look like, for example, certain high-risk teachers might not be encouraged to go. Or maybe that the classes or certain assemblies would certainly be canceled. So, and the classes would have to be spaced out so the kids are not as close, and you'd be cleaning the school more. So I think it's not right around the corner, but it's not out of our imagination that it would happen potentially within a few months, certainly in time for the fall. It's possible, but depending on what's going on, and a lot can change, it might look more or less like, school did last year. There may be some differences.
Nakia, I want to repeat, it's not that children are such risk, but as Dr. Sharfstein just pointed out, they're dealing with teachers who may be at risk. And one thing we know about children is they like to touch one another, push one another, get close to one another, congregate with one another, and then they are dispersed back into their homes and into their neighborhoods. So it's a very complex problem, and I think Dr. Sharfstein is right. And the White House saying that's not going to be the first step back. because adults are. I go to the grocery store. Everybody in the grocery store that I go to, and every clerk, everybody who's stocking shelves, well, with maybe one or two exceptions, which will now be eliminated, are wearing a mask. And most of them are wearing rubber gloves. So we're careful. But the kids, you can't have them do that. And it's not that they're going to get sick. That doesn't mean they can't get sick. They can, and they have. And we do have children who are sick. But it does mean that they're not as careful or cognizant as adults, and they then become carriers if somebody that they're interfacing with sneezes or coughs or and, you know, maybe they should wear a mask, and sometimes they do wear a mask, but, you know, kids will lose their mask pretty soon. In any event, it's a very good question. A lot of people want to know the answer to that. I don't have an answer, but it's not going to be tomorrow. Okay, next question.
Thank you, Congressman Hoyer. I think we actually have an answer on the question about drive-through testing in Calvert County.
Okay. I think it was Jared Charles, you asked this question. I hope you're still on the phone. I'm sorry I didn't have that answer when you called, but I'm glad we got it. Calvert Health is offering drive-through testing, 9 a.m. to 3 p.m. on Tuesdays, one day a week. And you can call 410-535-8436 for an appointment. You just can't show up. You've got to be on their list because they got to make a judgment as to whether or not, you know, testing equipment and tests are dear. They're not as plentiful as we need to have them, nor as fast as we need to have them. But you just can't show up. So again, that number, Calvert County drive-through testing, 410-535-8436 for an appointment. Okay, Charles, thanks.
Thank you, Congressman Hoyer. Again, if you have a question, please press *3 now. Our next question is from Willa in Fort Washington. Willa, you're on with Congressman Hoyer.
Hello, Congressman Hoyer.
Hi there. How are you?
Oh, I'm doing good. My question is, rather than open up the whole economy, why not let the governors, which know their own people, which know who is sick and who is not sick, why not let them determine when they're going to open up their own city?
Actually, Willa, contrary to what the president said a few days ago, where he said he had the authority to tell the governors what to do, he's changed his view on that. What Dr. Sharfstein referenced in terms of schools being in the next phase, as I understand it, and maybe one of my staff that's listening will correct me, what the White House did today was put out guidelines. But the president said it will be up to the governors in each state to determine whether or not to open, and if they decide to open, how to open. But what the White House did and the task force did was to issue guidelines which they were recommending be followed if, in fact, governors decided to open. But the president no longer either claims the authority, or at least he is not going to exercise that authority. I personally don't believe he has it, but even if he did have it, he has decided not to exercise it and to leave it up to the governors. Next question.
Thank you. Again, if you have a question, please press *3 now. Our next question is from Sean in White Plains. Sean, you're on with Congressman Hoyer.
Go ahead, Sean. Thank you very much, Congressman Hoyer, for taking my call and answering these questions. My question regards to unemployment. I am a self-employed person. I work in White Plains, Maryland. I file my taxes under 1099. Since about the 30th of March, I've been looking on the Maryland unemployment website to file for the unemployment relief for self-employed. And the only information it says is our system is not currently set up to process these applications. Send in your email address and they'll notify you when the system is ready. I do know that I have friends that live in Virginia and that are also self-employed, and their system for self-employed people for unemployment is already up and running. Is there any time frame that you know of as to when Maryland's 1099 or self-employed unemployment system will be up and running?
Good question. Gentlemen, which of you in the Michael or Andrew, which one of you wants to answer that question?
Sure, I can take a stab at that. Thank you for the question. Yeah, we do get that a lot. The extension of the federal benefits, the CARES Act extended unemployment insurance to independent contractors and the gig economy workers and sole proprietors. This is a new federal program. We are working to implement it. We should have an announcement in the coming days for a system to start collecting your information and issuing those payments as soon as we can. You've been to the website. If people will Google Maryland labor unemployment, our website will come up, and there's information on that website about how to apply, how to enter your email to receive a notification when the system is updated. But I would expect an announcement within the next week or so on when you can start receiving those benefits and start applying for those benefits. It should be soon. I know we're working with the U.S. Department of Labor to get a unified application that all the states will be using. I have not heard about Virginia.
You found the 1099.
No other state has done this yet. But we are working as soon as we can. It should be very soon.
The sooner the better, we know. But hopefully, Sean, I don't know what your income level is. I don't want you to stay on the phone. But as you know, as I said, if you filed a 1099, I don't know whether you were getting a refund, and if you were getting a refund, you gave them an electronic transfer number. If you did, you ought to be getting a $1,200 check, or again, depending upon your income. Between lower than 75, it'll be $25,000, and it will reduce from 75,000 to 99,000. And if you're at 100, you don't qualify for that particular program. So there is a possibility you'll get a check before you're going to get your unemployment. But again, correct me if I'm wrong, but that will also be retroactive to the time you were unemployed. Am I correct on that, Michael and Andrew?
That is correct. State benefits will be retroactive, as well as the federal $600 bump up back to March 29th or your date of separation, if you can show a loss of income due to the virus. That is correct.
Okay, thank you. Sean, and everybody on the phone, I'm sure that you're sympathetic with the fact that what we are facing is unprecedented, and the numbers are like 50 times and even more what they have been. And obviously the departments were not either technologically nor from a personnel staffing standpoint staffed to meet this challenge. They're trying to staff up, as you heard, and they're trying to do this as quickly as possible. And I know people are stressed greatly, and hopefully they will get this money as soon as possible, because we want it to go out ASAP, because we know that people need the money. They need the underpinning. Okay, next question.
Thank you, Congressman Hoyer. Our next question is from Chris, who's a small business owner. Chris, you're on with Congressman Hoyer.
Thank you, Congressman Hoyer, for taking my question. My wife and I own a business in Calvert County that today we employ 3 Southern Marylanders and have for many years. We applied for the PPPL on the morning of the 6th. We have not received approval yet from our bank as of this morning, and now hear from the SBA that the available funds are now gone. Tomorrow I have to make the most difficult decision we have about laying off our employees. Will you call on Congress to immediately approve additional PPL funding without tying it into non-COVID related items into the bill, and if so, when?
Well, first of all, the discussions that have occurred all have dealt with coronavirus-related expenses. What you're talking about, I think, is the Secretary of the Treasury, Mr. Mnuchin, asked for $250 billion for the Small Business Protection Act, Payroll Protection Act. We're for that, and I would hope that we would pass that hopefully within the next week, if not sooner. What we additionally asked for, Governor Hogan, who's the chairman of the Governors Conference, and Governor Cuomo of New York have jointly asked for a $500 billion additional support for the states and local governments who are all spending a lot of money they didn't anticipate on coronavirus-related efforts, as you can imagine. So we wanted to put in that bill $150 billion, not the $500 that Governor Hogan asked for, but $150 billion for state and local governments, because they need the money very badly to deal with coronavirus issues. In addition to that, what we asked was to put $125 billion of the $250 for very small businesses that are finding great difficulty if they don't have a bank, because many of these go through the banks, the small business loans. It's a very good deal. You said you had 2 or 3 employees. We want to get that program funded quickly, because what it provides, as you well know, I'm sure, is you can keep if you keep your employees on the payroll, even if they can't come to work, you can take out a loan to cover those costs, and that loan will be forgiven if at the end of the period of time, we're not sure of the date, that loan will be forgiven. So in effect, it'll be a grant. It'll be converted to a grant if you keep those employees on the payroll. And I can assure you that we will be funding that within the very near future. It needs to be funded. We want to get money in your hands and in the hands of people just like you. But we also understand that the hospitals have been drained heavily, as well as small and disadvantaged businesses have been drained substantially. So we're trying to help all of those folks. And very frankly, we're going to do it at some point in time. We're either going to do it within a week or we're going to do it within 2 or 3 weeks, because we need the money if we're going to keep people's head above water. Thank you, Chris, very much, and I'm hopeful that we will get that funded ASAP. I'm working on it.
Thank you, Congressman Hoyer. Unfortunately, we've reached the end of our time together tonight, and before I turn it over to Congressman Hoyer for some closing remarks, I'd like to remind everyone that if you weren't able to get to your question or comment this evening, please remain on the phone, and at the end of the call, you can leave a voicemail. Please leave your name, email address, and address if you don't mind, and your message. Again, thank you for joining us tonight, and Congressman Hoyer, I'd like to turn it back over to you.
Annalise, thank you very much for helping facilitate this call, and I want to thank everybody on the call. No matter how long this is, we wouldn't get all the questions answered. I think we had 11 or 12 people that we got questions, and hopefully the answers were relevant to many of the same problems that you had. I want to thank very much Dr. Sharfstein and Mr. Harrison and Mr. Fulginiti. We had 11,000 plus people on the call, for those of you who are listening. Mr. Fulginiti, Mr. Doss, and Mr. Umberger, who I don't think we got to say anything. I'm sorry about that, but I'm glad you were available. And I want to thank again all of you on this phone, and we need to thank them as well when we see them, the healthcare workers, the teachers, the sanitation workers, the people who are working in our grocery stores, our gas stations, our drugstores, our other essential facilities. Thank them. When I go into the grocery store, and I've been maybe 3 times in the last 2.5 weeks, which would probably be too many, but in any event, I thank everybody. I thank the guys stocking the shelves. I thank the checker who checks me out. We really owe them a debt of gratitude for showing the courage. And the healthcare workers, unbelievable. Police and fire, unbelievable. Here in Maryland, officials from both parties, I think Governor is doing a good job, and we're working very closely together. This is not about politics. This is about people's lives and people's livelihoods and the ability to support themselves and their families. In our state, we need to do everything we can to flatten the curve and mitigate the economic impact, a lot of which we've heard on the phone tonight. My staff and I will continue to work throughout this crisis to help all of the residents in our district, as we always have. We're here to serve you and make sure you have all the help you need dealing with the federal agencies and getting the most up-to-date information on what Congress is doing to protect the American people. And as I said on the phone, we're going to do more. The reason we're going to do more, because more is needed to keep people's head above water, to keep them healthy, and to keep their businesses going. For up-to-date information, this is important. I've said it once. I want to say it again. For up-to-date information and for any assistance you might need, I encourage you to visit my website, hoyer.house.gov. You can also follow me on Facebook, Twitter, and Instagram for the latest news and updates. Again, I thank all of you for joining this call, and let us all thank everybody who is working to make this a better time than it otherwise would be. It's a tough time. We'll get through this. We're tough, and we're resolved. And together, we'll get there. Thank you all. God bless.